be talking about what is breast reduction and who needs it and how is the procedure done. Breast reduction is a procedure where we try and reduce the size of the breast, along with, of course, reducing the skin envelope of the breast, and of course the size reduction is done by excising or removing the gland as well as part of the fat and the skin. So the often a question asked is, what does a breast reduction entail, or what exactly happens in the breast reduction? So when the size of the breasts increase, they can increase one because of increase in weight, so that the fatty component is increased. Then many patients have PCOS, so that is another PCOD, which is another cause for weight gain. Then of course hormones also play a role, so where the glandular enlargement or the glandular part increases in size. And then of course during pregnancy and childbirth, some patients tend to put on more glands and more weight in the breast area, and that is another major cause for concern. So when you have the fat, you have the and as the fat the size is increasing, of course the skin is also stretching, so it's the envelope which is stretching. So you need to reduce the skin, you need to reduce the glands, you need to reduce the fat component. So you need to reduce all three, but we also preserving your nipples and nipple connection with the rest of the breast, so that you're still able to breastfeed and still able to have normal sensations and function. So the lower part of the breast, so if this is the whole thing as a breast, and the lower 1/3 of the breast as a cone, that is the main area which is usually removed, and then we do a reshaping of the rest of the gland, and then reposition the nipple and the areola into the proper position where it should be, and of course remove the excess skin. So we are basically molding the gland. So nowadays we do this something called the short scar technique, which is basically molding of the gland rather than just the skin. So the effects of the procedures tend to stay longer, and then we remove that excess skin and we remove that excess fat, and then we reshape the whole breast to give you a smaller upright breast instead of a sagging breast, along with the reduction. Why is breast reduction needed? So that is an often asked question, that should I do it or do I need it? So the breast reduction, the breasts, as you know, come in various different types and shapes and sizes, and there is no one universal criteria to say whether you need a breast reduction or not. The breast reduction is basically more of a process where the patient herself is having issues, because of which you need to do a breast reduction. So if you have back pain, if you're having neck pain, if you're having shoulder pain, if you're having by the end of the day you feel tired because of the weight, because of the dragging sensation that you have, all these are symptoms that most commonly patients come in asking for a breast reduction for. So these are the signs and the needs of the patient, and that is why they finally think that yes, I need to get a breast reduction. Maybe that will improve my pain, it will reduce my pain, and I can do a lot more other things. Most of the other people around them, they tend to tell them that, oh, it's a cosmetic procedure, why are you doing it? You are good the way you are. So yes, cosmetically it tends to change the appearance of the breasts, and that is one of the reasons to be for a breast reduction surgery, but it is not the only reason. Most often, 99% of the times, patients coming in for breast reduction are coming in for functional reasons. When we say functional reasons, that is, they have difficulty walking, they have difficulty in working, they have pain in the neck, they have pain in the shoulders, they have pain in the upper back, and they have the dragging sensation. They are uncomfortable all through the day. By the end of the day, they feel tired because of the weight on the chest, and in summers they have issues like intertrigo or infections in the lower breast fold, and of course some other reasons. They can't find clothes that fit properly because their upper body or their chest is out of proportion to the rest of their body. So purely cosmetic reasons are very rare. Most of the times breast reduction, people coming in for breast reduction are coming in for a reason, and it is usually a functional reason. There is a cause for it, and that is when they have a breast reduction procedure. So yes, it is quite common. A lot of people opt for it, but it is not for cosmetic reasons. Most of the times it is for a functional reason, most commonly pain and discomfort. Another concept that floats around is yes, I have large breasts, but I'll go to the gym, I'll lose weight, and my breasts will reduce in size. Sadly, that really doesn't happen most of the times, because the component of increase in the size because of fatty deposits is quite less. So it is usually associated with a glandular increase and a fatty increase. So there is both, and there is usually a hormonal component to it, because of which your glands are hyperactive, and that is post pregnancy and or some other issues that you're having. Yes, some people have PCOD, which is again a cause for weight gain, and that purely by weight loss, and it's so hard to lose weight. If you have hypothyroidism, then that is another reason for weight gain, and there also you're not going to be losing weight even then you're trying to exercise and eat well. But on the flip side of it, yes, some amount of reduction will happen when you lose weight, because some of the fat will reduce, but not by doing any chest specific exercises. It is by an overall reduction in weight, which you can do by diet and exercise, but it doesn't alter the change, or the change is not very significant as to compare to maybe a surgery where you're actually reducing a bulk in that area where it is caused. One thing is, with that heavy weight, you're not able to exercise as you would want to. So that's another big reason. If you have heavy weight on your chest, you're not able to jog, you're not able to do any aerobics. You can maybe swim if you can, and but otherwise you're not able to do, and it hampers your day-to-day activities. Another question that is asked is, are there different techniques for the breast reduction? Yes, breast reduction has undergone changes since the last 30 years, and there have been newer techniques which have been introduced. But broadly speaking, there are three main techniques that you use. One is doing something called the scarless breast reduction, which is basically a liposuction of the breast, but that removes only the fatty component. It doesn't do anything to the skin, doesn't do anything to the glands. The second most common that is being done now is called the short scar technique. The short scar or the vertical reduction is basically where we try and mold the gland rather than the skin, and then the excess skin is then removed, so the effects of the procedure or the results stay longer. And then the third is the classical approach, which has been done over the years, which is basically an anchor scar, which is basically a circle, vertical limb, and a scar underneath, which is like an anchor. So the anchor scar is the inferior pedicle reduction, we call it, and that relies more on the skin to hold the shape in. So that is why there has been a gradual shift from the anchor scar to the short scar. But yes, it still has its place, and it can be done in certain specific situations. Another misconception is that it's a very painful procedure. Nowadays, with the improvements in anesthesia and the improvements in pain management protocols and medication, actually the pain is quite manageable. Most of the patients are back to normal activities in 3 to 4 days time, and usually they are all sent home on oral medications, which suffices, and by a week or so they are back to doing all the normal activities. And The anesthesia is usually a general anesthesia, but it's like a daycare procedure. You come in the morning, you can go back in the evening, and you have to have good support bras for the first 12 weeks, and that's about it. And the pain management is actually quite good, and I think 99% of our patients never had any issues with pain. And of course it is still subjective, but we have good enough pain medication to help you manage them. Question asked is, can I breastfeed? Yes, breastfeeding is possible even if you are done before you're getting pregnant, and we do it many a times because the size is causing major issues, so that is why they want to undergo a breast reduction. But we always tend to tell the patients that yes, we have had patients who have been able to breastfeed, we have had patients who are not been able to breastfeed also, and it's just because of the physical aspect of what we are doing. And thinking along those lines, the larger the breast reduction, the more chances you might not be able to breastfeed. As I mentioned before, we are going to be removing only that lower 1/3 of the breast tissue, and then we are going to reshape the gland. But even if 70% of the remaining breast tissue is normal, when we are reshaping the ducts are all twisted, and that could be a reason, most probably, because of which some people are not able to breastfeed. So what is the healing time? Many patients think that because it's a major procedure and there's a lot of cutting and stitching that is involved, it's going to take a long time to heal, and I don't have the time. And it's a daycare procedure most of the times, and you can go home the same evening, and you can get back to with our new anesthesia and pain management techniques. You're able to go back the same day, and it's quite manageable with oral pain medication, and you can get back to all your normal activities in 3 to 4 days time, and maybe even start going back to work, to all your other activities in by a week maximum, and maybe not doing any impact exercises. So that would take you about 2 to 3 weeks minimum, or it can even go up to about 3 months, where you need the healing to be complete before you can start causing shaking or causing stretching in that area. So that apart from those limitations that you can't do major heavy exercises or heavy lifting, you can get back to all your normal activities within about a week maximum. But most often they get back to their normal routine by about 4 to 5 days. So it's not a long recovery period that you need. Yes, for the scars to settle and mature and everything for the complete healing, yes, it is 3 months, but that doesn't hamper your day-to-day activities, and it is just the normal healing process of the body which the body needs to undergo, and the scars need to mature and settle down. This is age criteria for breast reductions. Age is not a criteria for breast reductions. As I mentioned, it is when you're having symptoms and when you're having issues with it. Very rarely, most of the patients are within the normal age group. We have either the younger age group, which is between 18 to 25, or we have the older age group, which is about 30 to 40. So the younger age group are the ones which are purely hormonal, or they have PCOD, and that is one major chunk of the patients. And these are the ones who are finding it difficult to lose weight, they're having hormonal issues, and because of which they have a glandular component which is more, and then you need to do a reduction for them. And the second age group is post-pregnancy or post-pregnancy, they have breast enlargements, and that is causing a dragging sensation. And so, but age is not a criteria. This is one of the few procedures where we can do it any age. Very rarely we do patients who are younger than 18 as well, because it is causing and that is where the hormonal component comes into play in these younger patients. Because of the constant stimulation, because of the hormones, there is an increase in the breast tissue, and it's purely glandular. Liposuction does not help, and you still have to do a excision. But the only problem with such patients is because the hormonal stimulation continues till about 21 or 22 or 23 years in some cases, So there might be a increase in the remaining gland tissue which is left behind again over the next 4-5 years. Even if you do it at around 18, you might still see that by 23 they may need a revision, or it might grow again. So this is something that we tell them. And in the later age groups, it's not an issue as long as you're medically fit. At any age it can be done and you can get it done. But when you're in the later age group, again you need to do more of skin reductions because the skin elasticity is gone, so you need to do a formal breast reduction. But age is not a criteria. As long as you're medically fit, you can go ahead and do it. Sadly, there are scars after breast reduction, so that is one of the major drawbacks of the procedure, if you may call it, because you have to reduce the gland and you have to reduce the skin. So when you're removing that kind of a tissue and that kind of that amount of tissue, then you need to remove some part of the skin as well, and that is what gives you the scars, because the glands are inside, that can be removed, but the skin removal causes the scars. As I said, the techniques are improved because now we are relying on the gland to hold the shape rather than the skin, so the scars don't stretch as much as they used to, and the scars don't become as bad as they used to before, especially in bigger breasts. But you still have scars which cannot be avoided. We try and minimize the scars. Actually, this is one of the procedures which, even if we are not satisfied as surgeons as to the final result and how the scar looks, or maybe some mismatch in the shape and the size, I think I can safely say I think 100% of our patients are always satisfied, or maybe 99% of our patients are satisfied with the breast reduction. The reason being that as soon as the first week they can notice the pain reduction in their pain, they notice the lack of that excess weight on the chest, and for them to get back to their normal activities, for them to be able to even run around or do jog or go to the gym or wear gym clothes, and most importantly maybe find some clothes that actually fit them properly, and they don't have to go searching for things that are made to their size. So all these make the procedure one of the most satisfying from the patient point of view. Even the 1%, as I would say, people who are dissatisfied or not dissatisfied by the procedure, but they might be dissatisfied with the scar, or they might be dissatisfied with maybe a mismatch of the positions or the mismatch of the size, or that kind of an issue. But when you talk to them about only the purely relief from the pain and the satisfaction from that point of view, I think all of them, I think 100% patients are always thankful to us for the procedure, and they say that it has improved their quality of life. They say that yes, it has helped us, and it changes their whole life, because they are able to move out more, they are able to wear dresses that they couldn't before, and they feel more comfortable with themselves, and they are able to get into other activities which they were not able to do before, like simple things like maybe going to a gym. And a common question is, can liposuction be done for me, and is it going to be worth it? Liposuction or scarless breast reduction can be done, but it only targets your fatty component. It doesn't target your glands. So typically in a breast, when you're doing, there is fat underneath the skin, and there are glands, and there is fat underneath, in between the glands and the ducts. So when you're doing a liposuction, you're trying to target and suck out only the fat component of it. You're not doing anything to the glandular component. And typically, most commonly, when you have a breast which is enlarged and need a reduction, it is a combination of both the gland as well as the fat. So when you need to do only a fat reduction, if it is a fatty breast, then yes, fat reduction with liposuction will help. But another thing is, you're not doing anything to the skin. So how liposuction works is the same way like it works in the arms, is by reducing the weight. So once you're reducing the weight and of course causing some amount of scarring inside. So that is what helps the skin to shrink, because now your weight is less and it's not dragging on the skin. But if your skin quality is bad and you have a lot of stretch marks, then it's going to look more and more emptier as you do a lipo. So lipo is not a solution for all breast reductions. For a specific subset of breast reductions, yes, it works, and that is what we try and identify, and we tell you whether you will be a good candidate for it or not. The misconception is that it should be done only after kids. Yes, by and large, if you can wait it out, then we would say that do it after you finish your pregnancy and your kids and your family. The reason being is you're shaping the gland, as well as you're removing the gland, and you're shaping the gland, and you're reshaping the skin. So we do a lot of patients underage, or underage means before even 18, before getting married, or 18, 19 also, because this is causing a functional issue to them. But yes, if you are in the borderline where you have been married and you already want to have kids and the pain is not so significant, then we would suggest that you wait and do it after your kids, so that you're doing it only once. When you're doing it in the younger age group, or you're doing it before you get married and get pregnant, or you have kids, and then what happens is during pregnancy, as the breasts enlarge and it changes, it can cause some more of the same changes which are happening because of enlarged breasts. So you can still have a sag, you can still have increase in size, and the scars may stretch. So if that happens, then you might have to go in for a revision once your family is complete. And that is why, yes, some people say that okay, wait it out and do it after you've had kids. But if your problems are more, then it doesn't make sense to wait for about 4-5 years or till you complete your family, and during that time be in pain and be having issues. So yes, it all depends on how severe your symptoms are and how it impacts your day-to-day life. If it is impacting your day-to-day life, then there is no sense in waiting. You should get it done and deal with the other things as they come along. Another misconception is that any doctor can do it, and people go to gynecologists because most often the women are meeting their gynecologists on a regular basis, and they want to do it. Yes, surgeons are trained to do removals, but they are not trained to do a reduction properly. Plastic surgeons are the ones who are actually trained to do proper reductions, because there is a technique to the madness, as we call it. It is when you see a breast reduction procedure, because the breasts are soft tissue and they are mobile, so there is a lot of planning that goes into breast reductions, and that is why you need to go to somebody who's trained in it and who's doing it on a regular basis. And also, unlike a bone where if it is a fracture, you take it out and you fix it and you put in 2 screws, it stays that way because it's a solid rigid structure. The breast is not like that. The breast is fluid because of the fat component and the gland component, and you need to have a clear understanding as to what you are cutting and what you are removing and how are you going to mold it into place. So it does take a lot of training, and it does take a proper planning and execution as well. And of course, when you are trying to reduce it, you can't reduce it too much. You need to have, it's a balance between your blood supply and survival of the tissues, then how much reduction is possible. So all these things take experience and it takes planning. So you need to go to somebody who's trained in it. Go to plastic surgeons or board certified plastic surgeons who are actually trained in these procedures and are also trained to manage the complications which come along with it and to minimize your scarring. So as long as you go to somebody who's trained in this and trained in these procedures and they know what they are doing, that should not be an issue and you should have good results. But yes, it is not a procedure which can be done by just about anybody. So these are some of the things or some of the common queries that people ask for as to what is breast reduction and how it's done. So if you have any other queries that you need to you want answered regarding the same, then you please drop in a comment below, and we will definitely get in touch with you to help you answer those.